Only on 7 News, a surgeon is charged by the state medical board with harming 17 Colorado patients. One even died.
And now Call 7 investigator John Ferrugia has tracked that doctor to one of the nation's most prestigious hospitals. And John, she's there after apparently leaving yet more damaged patients in her wake.
That's right, Ann. Dr. Denise Crute, a neurosurgeon, committed serious errors in the operating room, even operating on the wrong side of a patient's brain. But the state medical board in Colorado never disciplined her. Instead, we found a system that allowed her to give up her Colorado license and simply move on to operate on other patients.
I couldn't move my right foot, and I couldn't feel my right foot, and I didn't go in for a right-sided surgery, so that's when I knew something was wrong.
Mary Friday of Rockford, Illinois struggles to walk because she can't control her right foot, and she's in constant pain. She and the Illinois Medical Board charge it's because Dr. Denise Crute operated on the wrong side of her spine and caused severe and permanent nerve damage.
This has caused me a great deal of pain, more pain than I could tolerate being functional. You know, I was very spontaneous with my life and enjoyed life to its fullest. I can't be the mom that I was before and engaged with my daughter with all the activities that we did together. You know, and I'm not the wife to my husband that I was. It broke me emotionally.
Mary Friday is one of 4 patients of Dr. Denise Crute in Illinois who are suing because of surgical mistakes. But Mary Friday is asking whether her suffering could have been prevented. Our investigation found that Rockford wasn't the first place that Dr. Crute was accused of making serious medical errors.
And they told me that if it had been treated, when they'd found it out, he would have been fine.
More than a decade ago, Crute worked in Colorado, where state medical board records show she failed to treat an obvious aneurysm, and Michael Mendenhall's brother Dennis died.
He wasn't there. He was a vegetable. All I know is he felt pain.
The Colorado Medical Board charged Crute with mistakes involving 17 patients. In a negotiated agreement with the board, she admitted to making errors in Mendenhall's case and 3 others. Documents show Crute operated on the wrong part of the brain or spine, causing significant and permanent injuries. And she walked out of the operating room and went to another hospital while incisions were being made by an assistant on a patient under anesthesia. With those admissions, she gave up her Colorado license and moved to Rockford. Michael Mendenhall is frustrated that Dr. Denise Crute is still practicing.
They should have taken her license and sent her to prison.
But instead,
they just slap her hands and let her go. Well, that's just wrong. That's just somebody passing a buck.
after admitting harm to patients in Colorado and surrendering her license and moving to Illinois, where she's now accused of more malpractice, the question is, how did she get a job here in New York?
Dr. Crute, I'm with the Denver television station, 7 News in Denver, and I wanted to ask you if you thought it was appropriate.
Jerry?
Crute, her lawyer, and officials at the Illinois hospital where she worked all refused to talk to us. So we tracked down Crute in New York City, where she's now practicing at the prestigious Mount Sinai Medical Center.
You've admitted harm in Colorado, and then you moved to Illinois, and now you've got lawsuits in Illinois.
You just can walk away.
And that is exactly what she did in Colorado after negotiating with the state medical board to let her license lapse and agreeing never to practice here again. That's not a disciplinary action.
It is not, but it is a reportable action.
Marshall Smith is the program director for the Colorado Medical Board. He concedes that, like Colorado, many states have rules that specifically require disciplinary action from another state before a medical license can be denied. Our investigation has found that a voluntary surrender agreement, like that of Dr. Denise Crute, even if it's reported to a national database, means a doctor can still be licensed in other states, and patients are none the wiser. Why wouldn't I surrender my license in Colorado and say, fine, I won't practice here, but now I have no public discipline, I'm going to go to another state where I know I can practice?
You know, I really don't have a good answer for that.
And neither do officials at the Rockford, Illinois hospital who hired her after she left Colorado. Mr. Schertz, I'm John Ferrugia. Wanted to talk with you, I could, about Dr. Crute.
I'm on my way to a meeting.
We repeatedly ask officials of St. Anthony Hospital, OSF, for an interview. They refused to talk, so we went to Rockford to see them. David Schertz is the hospital CEO. You hired Dr. Crute knowing her record. In fact, there's a media plan that I have here to show you.
Excuse me,
Would you talk to me about Dr. Crute? No. And talk to me about this media plan?
What he would not talk about is this draft media plan put together just in case reporters in Illinois found out about Dr. Denise Crute's background. And not surprising, among the most important points, quote, the state of Colorado never suspended or revoked Dr. Crute's medical license. So, both Illinois and New York subsequently issued licenses to Dr. Crute to practice medicine without restrictions.
Could you talk to me?
But even more troubling is that the plan clearly shows that hospital officials knew the chance they were taking, suggesting a strategy of what not to bring up should they be asked about Crute's record in Colorado. We cannot use the no harm argument, says the document, because one of the 4 patients died. And the last of the 4 cases occurred in 2004, which prevents us from using a these are old cases argument. After the suits began in Illinois, records show St. Anthony's told Crute her contract would not be renewed.
These doctors are gaming the system. Of course they're going to come to you and say, here's my license, because they want to practice somewhere else. What's the board's obligation to protect patients all over the country?
The board's primary obligation is to protect the public health, safety, and welfare of the citizens of Colorado. That's our mandate.
But what about everybody else?
And we are able to perform that mission for the people of Colorado.
While that is true, it is little consolation to Mary Friday in Illinois, who learned that Dr. Denise Crute has now moved to Mount Sinai Hospital in New York City.
I thought that sounds about right. I thought she's trying to reinvent herself. She's got a license out there. I thought that's what she's doing. She's trying to reinvent herself.
Now, Mount Sinai Hospital officials claim that Crute is not performing surgery, yet in a sworn deposition that we got, Crute says she's in fact operating without restrictions. Meanwhile, in Colorado, the medical board is in fact following state regulations, and Marshall Smith makes the point, and a good point, that the board simply does not have the money to take every doctor to court to revoke licenses. It has to rely on negotiated agreement. That means Dr. Crute still has no discipline on her record. And in a statement, officials at St. Anthony Hospital in Illinois say they hired Dr. Denise Crute because she was accredited in Illinois and that she is an experienced surgeon. I'm John Ferrugia, 7 News.